Hello, my name is Masood. I'm a PhD student at York University at the moment, and I'm a co-author of the study concerning COVID-19 vaccine distribution back in Iran in 2021, which was published in the Applies of Computing journal, Elsevier, publisher at 221, 223, if I'm not wrong. Okay. I would say the main motivation behind this paper was the fact that during that time I was working as a volunteer to help to distribute and administer COVID-19 shots throughout the city of Mashhad, which is the second most populous city in Iran, located in the east side of the country, after obviously capital Tehran. And I would say throughout this experience, which lasted close to a year, maybe 9 months officially, I encountered and faced so many challenges. Obviously, some of them were out of our control, like we didn't have the biggest vaccine portfolio. Obviously, because of the sanctions, some of those vaccines, like Pfizer and Moderna, weren't accessible to the country. In the same time, the economic situation wasn't the greatest, so they couldn't import as fast as possible. And like many countries, Iran experienced a lack of trust among people to the government. So vaccine hesitancy was another issue as well. But some of those elements that mainly motivated this paper was the one that was the operational situation. I felt while there was some plans to how carry out the vaccine distribution and administration, they were done a little bit with lack of necessary overthought and detail. That's why me and Dr. Jamal and Dr. Taimuri come up with this strategy, which on its own is very straightforward way of doing it, but how we integrate the fact that obviously vaccines are a perishable product and how their inventory needs to be managed, the cost associated with it, and the risk of not getting vaccines to the people all been considered in this paper. So the whole package helps the people who were charged, which at the time was municipality and health ministry, a lot. And the thing is, this process very much is adaptable in the way that I feel like Iran and precisely the city of Mashhad went out to handle the COVID vaccine restrictions. Because while I'm not an expert in health issues, but as an engineer, I feel like the way Iran approached the whole COVID pandemic was in a hybrid approach. It was as a fact that there was social distancing. Some lockdowns were carried out in facilities that were prone to, being a place that a virus could be spreading quickly, like pools, like indoor places. But some of the other financial activities remained open because the country didn't have the resources like US, like Canada, or European country to subsidize people. And I feel like in retrospect, it was a wise decision because as we see it, like it's zero COVID policies done in some countries like China, Australia. While at the start it felt good, it had some side effects that are now showing themselves, like the economic stagnation, the fact that people were locked up in their houses for a long period, creating a lot of psychological effect and depression. I feel like a hybrid approach was kind of necessary, and this paper very much helps with the way that whole process can be carried out. And now that we are facing new variants and new strain of this virus, I feel like this methodology that we proposed in this paper still can be carried out. Obviously, maybe some accommodation can be done to it, but in the end, this helps the whole process to be done as efficient as possible, reduce the number of basic vaccine, in the same time increase the number of people who got the shots. And I hope this helps this process, and I appreciate that you listen to this piece. Thank you.